This week we have done some revisiting of past concepts and learned some new ones. We looked again at thoughts that hurt, thoughts that help, positive self-talk, and negative schemas, and how that might be able to help you eat more easily, live with discomfort. We've also taken another look at coping strategies and asked you to think again about how you cope with discomfort and whether your coping is the most helpful it can be for you. Then I've introduced some new concepts about how you think about discomfort and the words you use to describe discomfort can really influence your experience with comfort or discomfort, and asked you to be creative in looking at different ways that you might want to think about your experience, your sensations in your body. And lastly, we took a look at the way that you might move and the food that you might eat and how they might help you be more comfortable. So next week we'll be looking at the relaxation comfort connection. We'll be looking again at different tools, and I will be giving you experiences with imagery, somatic experiencing, mindfulness, and cognitive behavioral so that you can really put them up against each other and see which ones feel the best for you. We'll be talking about more powerful pain relievers and looking at help for the future because next week is the last week of the program and a little bit of wrapping up. So let's just be with this week and where we are and look at assignments for this week. Because I brought back up the way to use thoughts, I'm going to encourage you to keep on checking in with the compassionate observer, listening to the way you think about yourself and talk about yourself, and see if there might be an easier way that you might think about it when you're judging, to just notice the judgment or maybe change it a little bit. Continue with your log because you're going to need all of this information so you can make an assessment for next week when you're going to be developing a personal plan. Continue to experiment with psychoneuroimmunology. Help is on the way. Pairing any of the tools that I've given you with any pain relievers you may be taking, and if you're not taking a pain reliever, just to have that thought, help is on the way, and really notice how your body can relax knowing that help is coming. Try another physical or movement intervention. See about something else that might be helpful for you, and because we've been reviewing coping skills, check out a coping skill that you may not have utilized before or one that you don't utilize that often.